Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Diana Jaycox. Diana Jaycox is a registered nurse. She is also a certified diabetes educator and has worked in diabetes education for over 3 decades. She spent 13 years of her career in the U.S. Army Nurse Corps, with service during the Vietnam era. During her time in the Army, Diana received her Bachelor's of Science and went on to earn her Master's in Nursing from San Francisco State University, with an emphasis on the clinical case management of patients with diabetes. Diana currently works with patients at Washington Hospital, providing education for those who have been admitted to the hospital and have a diagnosis of diabetes. She enjoys working with patients to set and achieve diabetes self-management goals.
So welcome and Happy New Year! We're so glad to have you with us today, especially, one day after the new year. I'm really happy to see everybody here. We decided that since it was 2014, the diabetes education program, we are committed to helping people with diabetes live long and prosperous, healthy lives. And so we decided it would be a good idea to discuss New Year's and New Year's resolutions and just the whole idea of getting rid of the old and starting new with all our past problems behind us, and see if we could talk a little bit about setting goals and what we want to accomplish this year. So with that in mind, my name is Diana, and I am the other diabetes nurse educator for the outpatient diabetes program. I wear a dual hat in that I also take care of the people with diabetes who are admitted to the hospital. So I also take care of our inpatient hospital cases. So wanted to start out a little bit about talking about New Year's, since it is New Year's, and New Year's traditions. I'm a little bit of a history buff myself, so when I was doing research for this talk, I noticed that the celebration of New Year's began many, many years ago in the Mideast, about 2000 BC. And I thought that was rather interesting because I don't know how many of you know, but the first reported cases of diabetes were actually found, written cases of diabetes were actually found in the Mideast about the same time. Of course, back then they didn't really know what they were dealing with. They called it a wasting disease, but it's interesting to note that 2 different Egyptian physicians documenting 2 different, or what they thought were 2 different kinds of cases, actually described to a T the differences between a type 1 diabetic and what we now call type 2 diabetes. So it has a long history too, along with our New Year's traditions. This is usually the time of the year in which all your good plans for sticking to a meal plan and doing all the right things kind of start to fall apart. And so again, I always liked the whole idea, and the whole idea behind New Year's, which was, sweep out the old and all the past mistakes are behind us, and now we could start over again. And let's get back to what we know we're supposed to do and how we're supposed to do it, right? Any other, in our family, you know, it's a big thing about black-eyed peas. Anybody do black-eyed peas always for New Year's for good luck? Yeah. Anybody like black-eyed peas? I can tell you, you see, I'm not a native Midwestern, my husband is, and black-eyed peas are his family's tradition. And from my California standpoint, they taste like dirt. But I am forced every year to make them because he grew up with that. And so, you know, we all have certain foods that we are used to that are part of our whole being. That are so ingrained that we eat them, you know, sometimes without really even thinking about what else they might be doing for us. Not that black-eyed peas are necessarily unhealthy, but there are other traditions that you might have around food that are not necessarily during the holidays the healthiest things for us, right? And so, you know, we get caught up into that. Aunt Susie's been cooking for days, and we don't want to hurt her feelings. Those kind of things all kind of show up about this time. Well, one of the things that I do every year, and I still don't quite understand why I do this, is that whole thing of writing down my New Year's resolutions. How many of you do New Year's resolutions? Okay, great. And about around mid-February, do you take a look at your New Year's resolutions again and see how well you've done? Yeah, and how well do we usually do? If you're like me, okay, one of the most common New Year's resolutions is, anybody guess? Lose weight, right? Yes, that's my number one New Year's resolution. Every year I state that I'm going to lose weight. And about mid-February, I realized that I am not only have I lost and gained, okay, I think I found everybody else's lost weight in that month's time. And so there's a very rich tradition of New Year's, of writing out New Year's resolutions. One of the researchers that I looked at said that losing weight, eating more healthy foods, getting more rest, stop smoking, stop drinking. Those are like the number 1 through 5 resolutions here in the United States. And they are the most likely resolutions to not be followed through with. So again, it's rather interesting that we make all these great plans, but we have a real hard time sometimes being able to follow through with those. You think that might be a correct statement? Okay. So again, over 50% of the Americans that we know make New Year's resolutions. And it's so common that, believe it or not, the federal government even has a site in which they list some popular resolutions that you can follow and some tips on to how to meet those resolutions. I thought that was rather interesting. And yet, they are very quick to tell us that less than 12% of us are going to be able to succeed in keeping those resolutions. So, what were your New Year's resolutions? How many of us are going to lose weight this year? Yeah. So, what I'm hoping to be able to do is to kind of help us this year make a New Year's resolution that we're going to be able to follow through with, okay? And we do a lot of this work as diabetes educators. This is part of our normal curriculum. We talk about behaviors that are important for us to do in order to keep blood sugars under control. Most of us know them, but we go over them. And then we kind of have us pick out a behavior that we're going to try and work on during the 10 hours of class time that you're usually with us. And then we check in every time you come to class to see how well you're doing. So a lot of what I'm going to talk to you about today is stuff that we do talk about. And if you've been through our basics classes, you've probably heard some of this already. But I'm just kind of going to hopefully give us a new spin on some of this. So the experts tell us that there are two ways of looking at developing healthy lifelong habits. And when we're talking about behaviors or skills that we need in order to keep our blood sugars under control, we're talking about taking those behaviors and somehow making them into a habit, to a point where if you don't follow through with this, you feel very anxious and ready to get right back onto the wagon and do that behavior all over again, because you feel so uncomfortable if you don't follow through with this. So what they like to talk about first is that most of us are motivated towards healthier behaviors based on what we believe, our belief systems. And then the second way that we look at changing behaviors is looking at, there are certain stages that we go through when we are moving from thinking about this behavior that we have to do, eat healthy, for instance, to when we finally actually make that change. So we like to take a look at both of those types of ways of looking at behavior change and kind of go through them with our people who show up in class. And so we actually talk about the first step is to really determine what drives you to do the things that you do, okay? There are a lot of things that motivate us to doing different behaviors, and sometimes they're healthy behaviors, but we're not necessarily motivated by good health. For instance, some of us go to the dentist twice a year, like the dentist likes to see us for teeth cleaning and all that. Some of us are motivated because, like myself, you don't want to have a whole bunch of cavities, because the drilling out cavities is painful and something I would avoid at all costs. But there are people, believe it or not, who go to the dentist twice a year, not because they have a fear of cavities or they're looking for good dental health. It's because they are motivated by the way they look. Having nice, clean, shiny teeth is a way of, looking better and feeling better about themselves. And so it's sometimes important, especially when we are struggling with a behavior. Again, I keep going back to this weight loss and healthy eating, because that's where we see most of us struggling. What motivates us to do something, there may be something underneath that behavior that we haven't looked at. Again, looking at traditions around food, around socialization, control issues, those kind of things. There may be something in the background going on in your own life that you don't even realize is there. And in so doing, it's sabotaging your ability to follow through with a behavior. So we ask you to ask a few questions to yourself whenever you are thinking about making a change. First of all, what is it that you're trying to accomplish? If you're losing weight is your goal, why do you want to lose weight? Is it because you're tired of hearing your spouse nag at you about the amount of weight that you have on? Or is it because you truly believe that the amount of weight that you're carrying is in some way interfering with your life and you could do things better, maybe have more time outdoors or enjoy playing with your grandkids or something to that effect that having so much weight on is interfering with? If you can see, on the one hand, if you're motivated to lose weight because it's interfering with something you enjoy doing, you're more likely to follow through with the steps that you need to lose weight. Versus if you're doing it simply to get your spouse to stop nagging you, chances are you're not going to stick with that behavior change for long, because the minute that your spouse stops nagging, so does the behavior stop, okay? Again, asking yourself, why are you making this change now? What is it that has happened that has told you that now is the time to go through with this change. But a very important part of this that we often sometimes miss is, do you truly believe that you are capable of making this change? What I find very interesting when I'm working on a one-to-one basis with people who have diabetes, and we're talking about changing behaviors that interfere with their blood sugar control, is oftentimes they believe or they feel that they are doing everything that they are supposed to do that is humanly possible to do to control their diabetes. And they still don't believe that anything that they are currently doing or about to do or changing their behavior is really going to make much of a difference in their blood sugar control. In other words, their belief system is that blood sugar control is not something that is within their own individual ability to take care of, that it is something that somebody outside or some outside force has to take care of. Maybe it's that it's all your physician's fault and they need to jump in and somehow help you by being the diabetes police or whatever you might think. But if you don't believe that this change is possible for you to make, and you're at that stage where you're still seeing all these barriers that you can't seem to get around, chances are you're not going to stick with that behavior change for very long. So it's a very important question to ask yourself. The other thing you might want to ask is, what kind of things do I see getting in my way? I find that people who are able to make changes towards healthier behaviors are people who can look at things that get in their way, say their family schedule or the foods at holiday times or their nagging spouse, and see that as not so much a brick wall that can't be gotten around, but just a slight detour on a journey to better health. And they're able to somehow figure out a way around those barriers and actually continue along the road of healthy, whatever healthy behavior they've set up to do. So then that leads us to the next question, which is, how do I remove these barriers? Or what can I do to make this change possible? Looking at several experts, this is like a big topic these days in all the psychology journals, any kind of diabetes care journal. The big talk is what motivates people to make changes in their behavior. Okay? And for the most part, what the belief system model tells us is that we make changes in our behavior when we first perceive that there's a harm that's going to come to us if we don't change. And again, like we talked about before, a person must believe that they're capable of making that change. And most important, that the benefits of making that change far outweigh any difficulties or uncomfortable things that might happen to you while on your road to a healthier way of life. And the other thing that they talk about is that most people who are able to make a behavior change and make it a lifelong habit are very honest with themselves about what they are able to do, how much they can accomplish. They're very specific when they set goals for themselves about what they think they can do in, a short period of time, say a couple of weeks, versus a couple of months, versus a year's time. And they're able to lay out those steps in a very logical manner, okay? Rather than something highfalutin and non-specific, like my New Year's resolution of, I'm going to lose weight. The other thing that I've noticed though, and this is again just kind of a personal observation from working with hundreds of people with diabetes over the very long amounts of years that I have been a diabetes educator. And The one thing that I know is true, and I always talk to my physicians about this, is that I have yet to meet somebody with diabetes who wants to, or who does not want to be healthy. I mean, most people I meet really want to live a long, prosperous, healthy life. They really don't want to be spending their Christmas vacation in the hospital. You know, it's not like they purposely go out to get themselves unhealthy and the consequences of ending up in the hospital. They also, interestingly enough, most of the people that I've met, whether they've had diabetes for a short period of time or they've had diabetes for years, okay, whether they've had some formal diabetes education like you see here at Washington Hospital, or they've never had any formal diabetes education at all, most people with diabetes will tell me that they know and have been told at some point in time that poor blood sugar control is what leads to complications such as blindness, kidney disease, and amputations. Now, you guys have probably all seen this too, because you probably have run in from the minute you were diagnosed, you have met somebody who has been very good about telling you all the bad things that can happen to you if you eat that fudge at Christmas time, right? And every time you put something in their mouth, your mouth, they're more than willing to tell you why you shouldn't be eating that, okay? And they have some horror story that they are just dying to share with you at the dinner table, okay? I recently came home from a trip to Missouri to see my family, and one of the things that being a diabetes educator, when you're amongst family members who have on both sides of the family diabetes that doesn't run in the family, it gallops, and there are very few people at a family reunion in our family that doesn't have diabetes, okay? The discussion kind of always degenerates into this discussion about who has the good type of diabetes and who has the bad type of diabetes, like it's some kind of competition. And personally, I've never been really able to understand that. Can somebody give me a definition of the good kind of diabetes? Yeah, exactly what my thought is. I've yet to see the good kind of diabetes, okay? I willingly admit, after many, many years of working with people with diabetes, having had diabetes myself while I was pregnant, having numerous family members who have diabetes, taking care of your blood sugars while trying to live a normal, healthy, prosperous life is a lot of hard work, okay? And that in and of itself is very difficult to deal with, and to me, that's a definition of the bad kind of diabetes. So, you know, while there's hope out there, and I love to give people hope, to me, sitting around it like we do and kind of discussing the good and the bads really doesn't help us to get any better. But like I said, most people I know are very quick to tell you that poor blood sugar control is the leading cause of complications. The problem that I see with a lot of people that I meet is that they have a lot of trouble realizing that their current behavior, what they are currently doing with the way they eat, or how much activity they're getting, or the way they take their medicines, or monitoring or not monitoring, whatever it is, they have a very hard time putting that together with the complication or problem that they are currently having. For instance, the gentleman who I see all the time in the hospital who is continually trying to tell me that he got his diabetes during his heart surgery, that something in the heart and lung machine gave him diabetes, and is unwilling to talk about his behavior outside of the hospital and why that might be causing him to come back in, okay? So, bad consequences can happen to people, but I don't always see that fear, using fear as a motivator, as a very good way of keeping on course for making behavior changes. I call it the I don't feel bad now syndrome, okay? And so often with diabetes, you currently don't feel really bad. You may not feel really good, but you don't feel really bad. And consequently, it's very hard to stay motivated when you're feeling okay. One of the endocrinologists that I've had the pleasure of working with in the past, Dr. Steve Edelman, he is the founder of Taking Charge of Your Diabetes. He works out of the University of California at San Diego, and he has his own practice. And he's done a lot of work on what motivates people to take charge of their diabetes. And interestingly enough, having diabetes himself makes him very much aware of what it is that people with diabetes go through. And one of the things he's very good about saying is it's really hard to motivate us to make changes. I don't care if it's somebody with diabetes or somebody with heart disease or just a normal, everyday, no illness type person out there. It's very hard to motivate you to keep making changes in your life if what you're working towards is nothing. Okay? If you think about it, what we tell you to do is that if you do all the work and you make all these changes and you modify your lifestyle, what will happen to you is nothing. You won't have complications. You won't have spent extra time in the hospital. You will have absolutely nothing go wrong with you. For most of us, it's hard to imagine nothing. We can't see it, we can't feel it, it's not tangible to us. And so what Dr. Edelman says is that a better way of staying motivated is rather than thinking if I do all these things, I won't have complications, turn it around and be more positive about it. If I do all these things, then what I am able to accomplish is to get down on the floor when I'm 73 years old and play ball with my, 3-month-old, or 3-month-old, she was 9-month-old granddaughter, okay? That is, something that is more tangible that you can kind of see and do. So I'm going to challenge you tonight, just like Dr. Edelman challenges everybody in these Taking Charge of Your Diabetes seminars, to go home and find pictures of people your age or your age 5 years from now or 10 years from now, however long you're looking for your long and prosperous life, and cut those pictures out, okay? And if you're like me, you have pictures of family members, like my mother, who you can pin up on your refrigerator, and those are the things that are going to motivate you to stay on track and make these behavior changes. So your refrigerator should look something like this, okay? These are all people with diabetes, okay, members of the TCOYD seminars that we have gone to, who are leading active, healthy lives, doing things that they want to do even though they have diabetes. And this is what we all at the diabetes program want to assist you to have: long, happy, stress-free lives doing the things that you want to do. This is what you're working towards. If you keep that in mind instead of the nothing bad happens to me, it'll be a lot easier to stay motivated even in those really hard times like the holidays. One of the things that is helpful to do is to look at the last time, say you want to lose weight again, the last time you lost weight, what did you do? What things worked, okay? And how did you finally come about losing that weight, okay? Let's not concentrate on what caused you to gain it all back again or twice as much as you had before. Let's concentrate on a change that you made that you're successful at, okay? So that change didn't probably happen to you overnight, correct? As much as I'd like to think that I woke up 50 pounds overweight overnight, it didn't really happen that way. It's something that I got to over a certain number of years. And so consequently, we have to think about the fact that change doesn't happen overnight. And if you're talking about setting up long-term, lifelong habits, it's not going to happen to you overnight. It happens in stages. So to begin with, you probably thought about making a change. Again, using weight loss as an example. You begin to think that it might be very good for you to lose 5 or 6 pounds, okay? And you know it would be helpful, but you're just not ready to do it yet, okay? That's the first stage that everybody goes through when they're thinking about making a change in behavior, okay? Next, you start thinking about it a little more. In fact, every time you pass the refrigerator, you think about, boy, I should be losing weight and I should be eating healthier, okay? Maybe you're out on the road and you're hungry and you're passing by several fast food places and maybe a sit-down restaurant or cafe, and you're trying to make a decision about where you should stop. And you're thinking to yourself, boy, if I stopped at Burger King, it would be quick, but it probably isn't going to be good for me weight loss wise. And you explore what you should be doing and you kind of think this through, but again, you're going to do it someday, all right? Probably sooner than later, but again, you're not quite ready to do it yet. And then it's January 1st, and you step on the scale. And sure enough, you've discovered not only have you not lost the weight, but like I said, you found everybody else's lost weight. And so you are finally ready. This is it. This is my year. I am going to lose the weight. And you know that you're going to do it within this next month, okay? That's the third stage. That's the stage where you truly start developing a plan of action, okay? You begin to come up with a plan. You know what you're going to do, and you start to look at the things that you're going to need. In my case, I had to come home, clean out the entire refrigerator, throw away all the bad stuff, go out, make a list, go grocery shopping for the healthier foods, and make sure everything was prepared and easy to get to in the refrigerator so that we could make this change of losing weight. And then you begin to think about the things that get in the way, okay? The 2-hour drive to and from work I have every day, the fact that I'm tired at night and don't want to cook, and what are some of the things we can do to get around that? Oh, maybe I'll have the vegetables all cut up. Maybe the salads will be ready to go so I can grab it when I need it. The food, I'll think about what we're going to eat for that week and have it defrosted so I'm not tempted to run out and grab something on the way home from work. Those kind of things. And then the final stage that you go through, you've been through the action stage, you're actually starting to put your plan into place, and you've been doing it for a while. And according to the experts, it'll take about 6 months before that becomes a routine for you, and you can actually start to feel like it's become a lifelong habit. During that stage before, where you're putting your plan into action, there will be times where you fall off the wagon and you eat something you hadn't planned to eat. But this is the time where you are saying, okay, that's all right, I'm going to try it again, and you get back on track and you keep going. And if you are able to do that and you are seeing some results in nice steady weight loss, in about 6 months, the experts tell us, you'll begin to feel like this is a habit and you will not be craving the McDonald's French fries as much as you thought. It's important to give yourself a break. We talk about this in taking charge of your diabetes. We talk about the fact that not one single one of us is perfect. And while we all have things that we need to do to be healthier, we're going to hit a bump in the road. And there are going to be times where you fall into old behaviors. There are still foods in my life that I consider to be comfort foods that I reach for at times in which I am under an incredible amount of stress. Knowing that, okay, I have to be prepared for a plan when I fall into that mode, and what am I going to do about it, okay? But most people find that successful change occurs when you begin to see a bump in the road, not as an insurmountable brick wall that you can't get around and you can't get over and you can't get through it, but rather just a mere detour on your journey towards a healthy lifestyle. And again, what the experts tell us to do is that if we change our mindset and the way that we look at things, instead of looking at, like I talked about, nothing bad happening to us, but again, begin to think about the good things that this behavior will do for us, okay, we can learn to be less than perfect, make mistakes, and learn from them in order to keep on track. So, how do we get started? I went through some of our old toolkits and I managed to come across one that dealt specifically with changing habits. And I gave you that handout. It's about a 3-page handout. And it takes you through the steps one by one. So the first thing it talks about in that handout is looking at your diabetes care. What is currently going on with your diabetes? What are you trying to do? Are you on just diet and activity? Do you have diet and activity and some kind of medication that you're taking? Okay. Maybe you're trying to do diet and activity and insulin. Are you monitoring your blood sugars currently, or is that something that's only being done in the physician's office? Look at what it is that you are trying to do with your diabetes care. And then talk about what it is that you want to accomplish. What changes would help you to reach this goal? And if you're not sure about that, I kind of encourage you to take a look at the 7 keys to management, which I forgot to draw up for you guys, but you do have it in your handouts on your PowerPoint. These are 7 behaviors that the American Diabetic Association has determined are necessary for us to maintain good control over our diabetes. So first and foremost, we always have to talk about healthy eating. And these days, we're not talking so much about foods that you can't have. Remember I talked about comfort foods? Anybody else have foods that are very special to them that they have to eat? Yeah. Okay, macaroni and cheese. Macaroni and cheese is a comfort food for me, okay? It's something that I do on winter nights when I'm all alone and I don't feel like cooking. I reach for macaroni and cheese, okay? I don't know how many times I have said in my New Year's resolution that one of the things I'm going to give up is macaroni and cheese. It doesn't happen, okay? So I've given up talking about the things that I am going to give up in order to lose weight. And instead, I'm beginning to talk about maybe what I need to do is have a smaller portion of that macaroni and cheese. It's amazing how much one box of macaroni and cheese, how many servings that is. It's not meant to be eaten all by one person. It's meant to be shared. So consequently, maybe if I just had a spoonful, all right, and put it together with something else, in other words, use it as a side dish, then maybe I would be a lot healthier. Does that make some sense? Okay. So when we talk about eating these days and diet and meal plans for diabetes, we're no longer talking about foods that you can't eat. We're talking about portion control and the timing of our meals. And so maybe one of the goals you want to look at is being a little bit more consistent with the portions that you're eating at each meal, especially those foods like macaroni and cheese that turn 100% into sugar. So maybe those are the foods that you want to look at being very good about your portions. Maybe those are the ones that you need to concentrate on measuring each time you eat them. Okay? It's impossible to talk about healthy eating without talking about staying active. All right? Believe it or not, I got out of the U.S. Army so that I would never have to run 2 miles ever again. Okay? There is nothing about running that I find enjoyable. So you will never see on my New Year's resolutions a resolution to run more, okay? However, I have come to understand that the whole reason we eat, believe it or not, is to fuel the body so that the body can do activity. It was never meant to sit and soak. So consequently, even up into my old age, I have to find ways to be more active. So if that means that instead of taking the elevator everywhere I go, I'm going to start walking the stairs, so be it. If it means that I have to park further away at Walmart so that I have to walk clear across the parking lot before I get there, and then I walk around the entire store before I actually start stopping and buying things, then that's what I'm going to do. Or if it's much more fun to sit in my house with my nieces and nephews and my 22-year-old daughter and get up at every single time somebody does a spell on a Harry Potter movie and run around the room like musical chairs, then that's what I'm going to do. But find something that keeps you active, that you enjoy doing, that you're going to stick to, and that you're going to work into your life every single day from now until the time that it's time to go home, okay? Monitoring. I have a lot of patients that ask me all the time, should I be monitoring my blood sugars? And I ask them, why would you not want to monitor your blood sugars? How are you going to know if you're able to make any change in your diabetes management at all if you have no way of monitoring your blood sugars at home? Most of what you all have to do to keep your blood sugars under control is in your realm of abilities. In other words, you don't take me or your doctor home with you. 90% of diabetes is self-managed. And consequently, waiting until your 3-month visit with a physician to find out how well you're doing is probably not the best way to stay on track. And so even if you're only monitoring 2 or 3 times a week, for those of you who are not on medications, who are just using diet and exercise, or if you're monitoring 4 times a day because you're taking insulin with each meal, you have to have a way of knowing what your blood sugars are doing on a day-to-day basis, okay? So for some of you, maybe it's blood sugar monitoring and being more consistent you might want to do. Medications. These days, less than 5% of the people we see with diabetes can get by with just diet and exercise alone. The latest research has told us that by the time you have the diagnosis of diabetes, most of you have lost about 1/3 of the cells that are responsible for producing insulin for you. So if you are diagnosed and newly diagnosed with diabetes, chances are you're already producing less insulin than you used to. And you might need medication, if nothing more than a pill to help your insulin that you are producing work better for you. You may need some kind of medication. The other research that we've looked at tells us that about 58% of the people we see with type 2 diabetes will require insulin to take care of their blood sugars at some point in time in their lives. If you live long enough, okay, you are probably going to require some kind of insulin. It may not be insulin all the time. It may only be when you are sick and under stress, but you might require insulin at some point in time. And so to see people who have had diabetes for 14, 15, 16 years who are not on medication is very unusual these days. And a lot of times we now see physicians starting insulin a lot sooner than they used to in order to save the pancreas as much as possible. So it would not be unusual, especially if you've been doing healthy eating and activity and you're still not getting the blood sugar results that you need, to discuss with your physician the possibility that you might need some kind of medication. Or if you're on medication and you are still getting blood sugars that are higher than you want them to be, it makes no sense to continue to take that same medicine in the same amount in the same way if it's not doing what you want it to do. It's just an extra expense for you. It might be time to change your medicine. And so maybe that's a behavior you want to look at this year. We also know these days that the way we deal with the stresses in our lives, and none of us have stress-free lives. If we had stress-free lives, we probably wouldn't be motivated to even get up and do anything. So stress is kind of a part of everyday living, especially these days. But how you deal with that stress might make a big difference in your blood sugars. We know that all of us are equipped with a prehistoric, primitive mechanism inside of us that the minute our bodies sense that we have to either run away from a stress or fight off a stress, we are going to produce sugar because sugar is our fuel. So even if you don't eat sugar, if you put your body under stress, your blood sugars can go up. And consequently, learning to deal with the day-to-day, everyday stressors in our lives and somehow find a way to cope with them. Find something good that we enjoy doing, take a walk, call a friend, go off and read a book, listen to music, whatever it is that we need to do to help ourselves deal with our everyday stressors, we need to find a way to do that, because you could be doing everything else right and still have poor blood sugar control simply because of the stresses your body is under. When we talk about problem solving and reducing risks, which are the last two behaviors on our list, we're really talking about advanced diabetes management. And for some of you, you've been at this long enough that you've gone beyond what the basic diabetes survival skills, we call them, okay? And you're headed into that stage where you really should be able to make adjustments in your treatment plan based on what you're seeing happening with your blood sugars. In other words, you've gone beyond the just taking your medicines, doing your blood sugars like your doctor has told you, and you have graduated into, I can actually see a pattern in my blood sugars. I know when I eat a certain amount of this particular food, I am going to see 2 hours later an elevated blood sugar. And so my way of coping with that is to eat it less, to eat less of it, or not to eat it as often, or to take a walk after I eat it, something to that effect, okay? Or those of you who are on insulin may even be adjusting your insulin based on where your blood sugars and the foods you are eating. It's what we call pattern management, and it's problem solving. So you've gone beyond Diabetes 101, and you're now into the Diabetes in the 300 series, okay? And the upper graduate courses. The same thing with reducing risk. We're talking about preventing kidney disease, new blindness, and lower extremity amputations, heart disease and stroke. You might have gone to a point where you're now looking at making sure that you don't have any complications from your diabetes. And what else besides blood sugar control do you need to do? Is your blood pressure okay? Have you looked at your cholesterol levels? And what kinds of things can you do to make the whole picture work well? Okay? So these are the behaviors that we look at, and we ask that you start looking at picking one or two of these and making a goal of what you want to do to take care of these behaviors and make changes in these behaviors. Then you have to ask yourself, what stage of change am I in? I'm not ready to change right now. I'm thinking about doing it sometime. I might do it in the next month. I'm doing it now. Or for some of you, I've been doing it for about 6 months and I need to keep doing it. Once you've decided what stage you're in, you can kind of consider what actions you need to do. So for some of us, we're still in that, I'm not quite ready to make a change yet. I know I need to, but I'm not ready to yet. And we want to be moving closer to that action stage where you actually have a plan. So you might want to consider the benefits. For instance, if I ate smaller portions, what would happen to my weight? And if I lost that weight, what kinds of things that I am now having difficulty doing would I be able to do better? What part of that change is going to be hard for me to do? What keeps getting in my way of making this change? Why haven't I made it before? And how can I work around these problems? Maybe you're ready to take action. Maybe it's time to make a change. You will need a realistic and specific plan with a way to measure how well you are doing. In other words, you know, this is what I will do, this is when I will do it, this is what I need to get ready, this might get in my way, this is what I'll do instead, and here's where I'll start. So when we talk about making goals and setting goals in our basics class, for instance, let's say that you're one of those people who's been leading a very sedentary lifestyle, and you've now decided that you need to put more activity in your life, that that's the easiest behavior for you to tackle and make a change in. You might say something like, here's what I will do. I will begin to walk every day for 10 to 20 minutes, at least 5 days a week, and 7 if I can. I will do that walk. Now you have to think, is it easier for you to do it first thing in the morning? Or are you one of those like me that needs to have somebody alongside you kind of helping you along the way? Or as my father always says, pinching butt makes backpacker walk faster. So we do our walk in the evening where my husband and I can kind of cajole and help each other get around the block, okay? What do we need to do in order to get ready? Well, first of all, we needed a better pair of shoes. We needed to plan the route. We needed to think about the timing and what we had to do so that we had plenty of time to do this before we were suddenly wanting to drop into bed. So we had to kind of change the meal plans around and all of that in order to get ready to do this. And then what gets in our way? The minute we get this all figured out, it starts to rain. I'm not particularly fond of being very wet, and so consequently we put the walk off. Anybody ever seen that happen? So we had to have a plan on what we were going to do if we suddenly stepped out the door and it was pouring down rain. Now, of course, you know, my husband being the great outdoorsman, he has all these fancy camouflage rain suits that, you know, for some reason we have them in every single size. Okay? I think it's because his weight has changed over the years. So sure enough, there's one that still fits me. And there's one that would fit 2 of us, okay? And every size in between. So we could do that. We could put on the rain suits before we leave. Or we could take a car and go around to the nearby mall and maybe walk indoors. But that meant changing the time that we were doing our walk. So in other words, you have to have some kind of plan in place for what you're going to do when something gets in your way. Okay? And then you have to have a start date, because if you're like us, you'll put this off and you'll be thinking about it forever. And the next thing you know, it's going to be February 14th, and you haven't started on this plan that you made on January 1st. So it's always a good idea to put down a start date. So as we said, we will start this next Monday at 6 p.m., come rain or come shine, and this is what we're going to do, okay? Now, our handout didn't tell us what, it doesn't really go into this last part, but what do you do when you've been doing all this good stuff, and you've been doing it for a while, and you're seeing results, but you need to stay on track? Right? So many people start out well, and they do the behavior for even more than a month or so, but then they start to slack off. And anybody can tell you, once you slack off, it's very hard to get back out there. Once we let the rain stop us, it's really difficult to get motivated to do that walk again, even though it's wonderful weather. So what we like to do is talk about some ways and some of the roadblocks that might be getting in your way and what to do about them. Make sure that you're willing to ask for help. So often we want to go it alone, and we don't want to bother anybody. But when we were first starting this walking plan, we actually, the first time we went out and started thinking about walking around our neighborhood, we noticed that there were a lot of people we knew in our neighborhood that also needed to be walking more. And we actually started thinking about going up to them and knocking on the door and inviting them to go with us, so that we'd have kind of this neighborhood walking club and we could all get healthy together, okay? Maybe you just need, like, Alcoholics Anonymous have a mentor. Maybe we need a weight loss mentor, somebody who's going to call us on the phone and see how we're doing, and maybe call us right when we're putting that chocolate chip cookie in our mouth, okay? And we have to stop chewing to talk to them, so maybe we'll put the cookie down. Those kind of things might help you to stick to a plan. So think about that. Think about people that you might want to include as your support people, okay? And then a really important thing I found that really works to keep you on track, and again, it's not talked about in our handout, is having a reward in mind for sticking to the plan. And in our case, it has to be a reward that, even though we might reward ourselves with going to the movies, it doesn't mean we're ordering the extra large popcorn with the extra butter and all that salt on it. We had to think of a plan for reward that didn't involve eating more as a reward. So I came up with this great plan that for every 5 pounds I lose, I get a new outfit. Okay, so my husband isn't too happy with me, but we have managed to work out a budget in which I can do that. Either I'll get a new pair of shoes or a whole new outfit. We haven't quite decided yet. But there's a way of sticking to the plan and rewarding ourselves for having accomplished what we're going to accomplish. And I think you'll find that if you follow through with some of this and you do the exercise that we have given you as a handout, that you will be successful this year in meeting your resolutions. So, we want to remind you all to have fun, to enjoy yourselves, okay, while you're getting healthy, and let you know that we really do believe in you and believe that you can accomplish all these things. And we're wishing you a happy new year, a very prosperous and long life. Thank you.